is nothing but an inflammation that's or infection that inflame the air sac in the lungs, okay, which may be fluid or pus formation like, and that is what we call pneumonia. Yes, it can happen in one of the lungs and it can happen in both lungs. Okay, now, what is the pathophysiology of this particular pneumonia? The pathophysiology of pneumonia is that an infectious agent invade the lungs and causing the alveoli inflammation. There will be fluid accumulation and impaired gaseous exchange within the lungs, and that is where the problems of pneumonia comes with. Yes. Okay, now let's go to the cause and risk factor of pneumonia. Remember, based on the type of pneumonia, we have what we called bacterial pneumonia, viral pneumonia, and fungal pneumonia. And the same way is how the cause of pneumonia comes into play. Okay, now the causes of pneumonia can be bacteria. An example of the bacteria that causes pneumonia is called Streptococcus pneumoniae. Okay, now based on the viral cause, example of the viral cause of pneumonia is called flu or at times COVID-19 infection. Okay, we have fungi cause. We also have aspiration of food, I mean to say, and flu and liquid. And that is where conditions like viral pneumonia comes, aspirational pneumonia comes into play. Okay, we also have chronic pneumonia, and under chronic pneumonia you see something like uh, COPD, that is chronic obstructive pulmonary disease, and diabetic conditions. These are under the classification of chronic pneumonia. So when COPD becomes chronic, prolonged to heal, it can cause uh, inflammation of the lungs. And remember, the lungs, in the lungs we have the alveoli, which contain the air sac, and inside the air sac we also have what we call the surfactant. And the function of this surfactant is to allow recoiling movement of the lungs both up and down. And when the recoil is not there, what is going to happen? Instead of the exchange that the recoil will bring, it is exchanging it with the formation of purulent exudate or pus formation within the what? Lungs. And that is what we refer to as pneumonia. Okay, now we also have causes that are due to smoking. Remember, smoking contain what we call nicotine content, and this product of nicotine content is not healthy to the lungs, and it can cause a kind of sensitivity reaction that will lead to formation of fluid or pus within the lungs, leading to what we call pneumonia. Okay. Another cause are people that have weak immune system. Yes. Which people have weak immune system? People who are on chemotherapy drug or cancer drug for management. Their immune system is always suppressed due to the effect of the drugs. Which people again is prone to this is people that are human immunodeficiency virus patients. Their immune system is always what? Weak. And as a result of that, it will affect or lead them to have, or they will be susceptible to pneumonia infection. Okay. Now, let us talk about the signs and symptoms of this particular condition. One of the signs and symptoms of pneumonia is high fever. Okay. And another one is productive cough. Yes, because the pus that is formed within the lungs need to be expelled, And that is where the act of productive cough comes into play. Okay, you can have chest pain, you can have shortness of breath, and general fatigue, generalized body weakness can come into play. How do you diagnose person with pneumonia? Number one thing to know if somebody have pneumonia is to do chest x-ray. It will show. Yes, if it will show there will be some kind of opacity within the lungs that will determine that yes, this patient is coming down with what? Pneumonia. You can do blood tests like blood and sputum MCS. Yes, if there is presence of Streptococcus pneumoniae, it is an indication that this patient have what? Pneumonia. Yes. So that is why it's good to bring to the notice of everybody that cold does not cause pneumonia. But cold, when you have developed the condition already, taking cold drinks and not covering your body very well is a kind of complication you get from this what condition. Yes, you can also do physical assessments, head to toe physical assessment to know that this individual is coming down with what? Pneumonia. Are you getting me? So, what are the treatments of this condition? The treatment of pneumonia is based on which type that the person have. If the pneumonia the person have is due to bacterial pneumonia, we are going to use antibiotics for the treatment. If it is viral pneumonia, we are going to use what? Antiviral medication for the treatment. Okay? And if it is fungal pneumonia, we are going to use what? Fungi infection, uh, fungi medication for the what? Treatment. Okay? So now let's go to the complication. The complication of this pneumonia, you see people having uh, respiratory failures are one of the complications of this what condition. Yes, respiratory failure. So you see individual coming up or coming down with respiratory failure, just know that it is a potential cause. And we also have some conditions like what? Sepsis. Yes, systemic infection. Systemic infection is one of the conditions that this can lead to. So now at this end, we have come to the end of this particular beautiful lecture. And if you see this very interesting, I want you not to forget to subscribe to my YouTube channel for you to, have videos like this anytime I come to live. Yes. Remember to share my video, remember to like, and remember to comment. Thank you for watching.